So, Berto, chapter 3, in which we review the pandemic years.
Yep.
This is chapter 3. We've already had chapter 1 and 2, and now we're starting just before the lockdown in the United States. So let's get into it. What do you say, Berto?
Let's do it.
This is the Psychology in Seattle podcast. I'm your host, Dr. Kirk and Humberto. I'm a therapist and a professor.
My name is Humberto Castañeda, and I train people how to balance on unimotors.
So, March 10 is a Wednesday, and I have already gone remote at the university, but from my understanding, anecdotally, the vast majority of professors have not. And for the people who could work at home, I think a lot of people are starting to opt to do that. So it's still well before any kind of official lockdown, right. Well before I would say the majority of Americans are taking this seriously. It's starting to get worrisome, but so just kind of the freaks are freaking. You and I are freaking.
Yeah.
March 10, Snohomish schools close after an employee tested positive.
That's March 10th?
Yeah. So
wow.
That's later now we know where this is headed, but at this moment, you have all of Snohomish schools, which is north of Seattle. You have you had one school in around there, Mill Creek, shut down a week earlier because one of the students had tested positive. So at this point, in terms of official closures, you almost have nothing that's really closing.
Dude, I think I'm definitely going insane at this point because I'm pretty sure my daughter's school was still open.
Yeah. In person, no masks, no. Right. They probably, as a precaution, put out more hand sanitizer. You know what I mean?
I'm sure I didn't, but I would love to imagine that I was sending my daughter with a mask, but I probably wasn't. But I got to tell you, I was freaking out because, now I was like, I'm going to catch this thing. They're going to get it at school. I'm going to catch it.
Yeah.
I was so worried.
I mean, at this point, were we hearing about the horrificness of the disease, like the fact that you were drowning in your own phlegm?
So I had heard all of that.
Yeah.
Now, but at the same time, though, so the flip side of me being oddly hyper informed early is that I also knew that it does affect more elderly and affects more like people with pre-existing conditions so I wasn't necessarily thinking I'm gonna catch this, and if I catch it I'm dead, right? I wasn't thinking that, but I was worried. I was like, I might catch this and I don't know what's gonna happen.
Yeah, if you would have asked me the statistics if I would die, I would say chances are I wouldn't, but I don't want to roll the dice on that one.
No.
And the main thing I was worried about was the anxiety I would have if I came down with it. Because in the ramp up, in the first few days of symptom onset, I don't know where this is headed. And honestly, half of the anxiety was, I don't want to be on a respirator because I don't know what that's like. I don't want to find out what that's like. But
and do you remember, it was true that at this point, the stories were that relatives weren't being able to say goodbye.
Yeah.
The other thing was that
But just imagine you have a machine, a tube that is shoved down your throat.
Yeah.
You can't talk. You can't control your own diaphragm.
No.
It's just doing it for you. That's torture. That's what you do to people when you're trying to break their brain.
And I was still reeling from my illness that had end of January, beginning of February. So like you said that you were nervous when you went to Tahoe because you had been sick in Mardi Gras. I was thinking, oh my gosh, well, pre-existing conditions. I don't know what I had. What if I get more because of whatever I had or didn't have? I was worried, but there was not much I could do. I'm like, well, I was working from home, but
the vision I had in my mind was, if I get it, and at some point around this time, maybe a week later, if you would have asked me, do you think I'll get it? I think I would have said, yeah. I mean, the way the science is looking, that it's almost impossible not to get. So I'm pretty sure I'm going to get it at some point. Turns out I didn't in all likelihood. But the vision I had in my mind was, I'm very, very sick. I can't breathe very well. Because I started eventually hearing those reports. There was this one episode of This American Life.
Yeah, your oxygenation drops and drops and drops.
Yeah.
Yeah.
And there was this episode of This American Life that came out pretty closely around here where one of the parents got COVID and quarantined in a room in a house with the other parent and a couple kids, and the terror. And this was a young, healthy couple, and they were talking about how they couldn't breathe, and they were calling the doctor, and the doctor was saying, don't come into the hospital because you're not sick enough, and we don't, and even if you were, we don't have the beds.
Yeah.
And so that's what I was imagining, was just laying in bed, can't breathe, in the 3 a.m, can't sleep. Stacy can't do anything for me. She can't even be in the room with me.
Nope. And you can't go anywhere.
And I can't call the hospital. And from all accounts, they're just telling you, screw you, just stay home and stop complaining. And I probably wouldn't die, but I don't know if that'd be very reassuring in that. So I was worried about the anxiety and the discomfort I was going to feel. That's mainly, and that was pretty terrifying. It wasn't a pleasant thing to think about.
I don't remember at what point it was. I'll have to ask, because we had our neighbors, they all ended up getting COVID very early in the pandemic, like almost right at the start.
Those neighbors you've been talking about?
They no longer live there.
Oh.
But the father...
A different house you're talking, not the pod people.
Not the pod people, no. The father was so sick that they were in the ER at the hospital, probably with a tube.
Oh.
If I remember right, because they were there for they were in the hospital for a full week, maybe 2 or something.
And you knew about this as it was happening?
Oh, yeah. Because we were already... So this must have been like...
April or something?
April, probably. But it was right at the beginning.
Yeah.
And so think about how freaked out I got. I'm like, they're right there.
Yeah.
And, it's just... So, luckily, he survived. He recovered. The family all had it, but recovered.
Yeah.
And he had the worst symptoms.
Yeah, and the trauma of that, just the feeling of you can't breathe, and then the long-term effects. I mean,
and they couldn't visit him.
Yeah.
So he was by himself in the hospital.
God.
Yeah.
So March 11, the World Health Organization, WHO, declares a pandemic.
Right.
Now, let's define a pandemic. The CDC defines it as a pandemic refers to a disease event in which there are more cases of disease than expected, spread over several countries. When I read that definition of from the CDC, let me read the WHO definition. That's actually statistics. So when I read the CDC's definition of a pandemic, doesn't that sound real loosey-goosey?
Oh, yeah.
A disease event in which there
has more than expected.
More than expected across several countries.
Yeah. Sounds like that we've had a lot of pandemics.
Yeah. I feel like they need a different word, like COVID level pandemic, or I don't know, DEFCON pandemic 5 or something, because pandemics are probably happening every year. The flu traverses several countries every year.
We have numbers for earthquakes. We have numbers for hurricanes.
But some flus or years are worse than others. So
why don't we have numbers for pandemics?
Yeah, we'll call them by male names, we'll name them after Trump's children.
Oh, jeez.
So the WHO says after more than 118,000 cases in 114 countries and 4,200 deaths, the WHO declared COVID-19 a pandemic. So I don't know if that was March 11 or if it was later. It sounds later, doesn't it? 4,200 deaths. Do you think they didn't have 4,200 deaths by March 11 around the world?
Worldwide?
Yeah.
Maybe, dude. Italy was... They were past there.
And China.
China, of course.
Yeah. Okay. Well,
and it wasn't just Italy. There was there's another European country that was.
Yeah. Like Moldova or something, one of those. And so I maybe that's it's in my notes, so I'm wondering if that's associated with March 11. But anyway, so then we have to define. Okay, well, when does a pandemic end?
Right.
Has the pandemic ended, bro? Right. What do you think?
I don't know, man. So if you ask me, the fact that there is right now a crazy wave in China where they have, wait lists for crematoriums, where they have, lack of supplies, medical supplies, and they are having record-breaking, by their own numbers, record-breaking infections and deaths, I think the pandemic is not over.
Right. So let's look at the definition of when a pandemic ends. They basically defined it as when people and institutions behave similarly to before the outbreak. So are we there?
I see. Well, regionally, localized wise, yeah. But
are we though? Because I don't know if
everything.
I don't think we're behaving similarly. You know?
Well, similarly, well, let's look at it this way.
Because the question is, will we ever behave similarly?
Well, that's fair, but we can't say, like, just because we end up saying, you know what if from now on at big events we require masks? Okay, that doesn't mean the pandemic's still going, right? That could just mean, like, you know what, why don't we prevent flus and other things too? But that's not happening. Like, you can go to many big events now and not have to wear a mask.
Mm-hmm. But there are periodic masks in Seattle, for example.
Yeah.
I think you're going to you still see a lot of masks. I mean, there was a store, like a secondhand store, record store by my house that never did not mandate masks.
There are some things that haven't returned. You're right. Like, I go to certain, like I go get my blood drawn and I wear a mask.
Yeah, that's the other thing. Like going to my doctor.
Yeah, you have to wear masks.
Yeah, it's been, so that's not, so to me, and there's no hard definition of when a pandemic ends, but to me, it seems like the end of a pandemic could be defined as when there's a new normal established, right?
That is hard though, because yeah, okay, fine. Because it's just a definition.
Because experts say that the COVID coronavirus is here to stay, just like the flu.
Then we need stages. We need to say, look, the chronic stage of the pandemic is over. Now we're in the post-coronal stage of the pandemic, whatever you want to call it, because it's definitely not the same.
Yeah.
Right?
Yeah.
It's not the same. We are not the same as before, but it's also not 2021.
But it's arguable that we'll never be the same. It's arguable that we're smarter now than we were before. And so does that mean that we're in a permanent pandemic? I don't know. It certainly feels that way to me. I've at no point since March of 2020 have I felt like it's over. I've never felt like it's over. You know what I mean?
Right. Like I'm pretty sure I would probably wear a mask now on every flight I take, just because.
Maybe for me, when the pandemic ends is when I stop checking the statistics of infection rates.
Well, but then that one ended for me a while ago.
Because I still check almost every day.
Yeah, I stopped that one.
Because I just want to know, maybe every other day, I want to know if it's increasing and what the current variant is. But, I'm checking that all the time.
There is this aspect of which I just feel, and you kind of just made this point, but I feel like before we were all just like really blissfully unaware and being dumb about things.
Yeah.
Whereas now I've gone about my business, but I still take some precautions.
Yeah, no, I've gone about my business. Right. And you and I went to Disneyland last year. That's definitely going about.
We didn't wear a mask in one's business. Lot of that. Yeah.
Well, we wore a fair amount of masks when we went inside.
Yeah, but not the whole time. Like, we weren't permanently masked.
And the numbers were
low.
Were very low at the time.
Yeah.
Low. In fact, I think one of the lowest periods of the past 3 years was that beginning of April of 2022.
And I gotta say that was such an oasis, I think, for all of us and for my kids and stuff, like, just be like, wow, we're at Disneyland. Like,
we're breathing in other people's air.
Can you imagine? Yeah, it was
we
really
were
magical.
Some of the only people wearing masks occasionally.
Yeah, I know.
Like, we were some of the only people. So someone emailed in relation to this, that listener K, they say, a couple weeks ago, I left a comment on one of your videos using the phrase, "You have modeled for us so many times," quote unquote, "it hurt my feelings," in response to you saying the pandemic was essentially over. So just chiming in here.
Interesting.
I apparently said something like the pandemic was essentially over and it hurt this person's feelings, and they commented on YouTube. And what I'll say is, if I said the pandemic is essentially over, that's not how I feel about it. I might have worded it that way. More likely, though, if we read the transcript or listened to the snippet, I probably said something like, the pandemic is basically over, meaning for a lot of people, they've returned to their normal life. I personally do not feel like everything's fine. Right. Do you know what I mean?
Right.
So I want that to be clear. Also, there are still thousands of people dying every day. I am aware, or I don't know how many people are dying worldwide every day, but I'm very aware of those deaths, and I do not look at those in a light way. Like each one of those lives is a special human being with a life and a story and a glory and a people around them. I, at my age, feel that. It's not a statistic, and
it's not. It's real people.
So when that ends, maybe that's the definition, is like the pandemic ends when people stop dying from it, which might not ever happen. I don't know. I do not feel as though the pandemic. Okay, so listener K says.
By the way, the current worldwide average is around 2,000 plus daily deaths.
Okay.
Yeah.
Which is, I think, relatively low.
Yeah.
To previous.
Compared to previous. Yeah.
Yeah. Listener K says, hurt my feelings when you said the pandemic was essentially over. I am disabled. If I get COVID, there is little chance I will survive. And if I did survive, I would likely be pushed into the category of having to choose medical assistance in dying. It means I am still in isolation for the most part and have to wear an N95 mask every time I go outside just to walk the dog. And I thought my illness had me isolated before the pandemic. Ha ha. I have experienced a lot of discrimination and frankly just odd abuse from being disabled in this pandemic. End of email.
Oh, man.
So yeah, I absolutely know about, and listener K went on a longer email talking about how even, well, I can't remember what to say, but I know I've had clients in this category for decades where they've had issues that mean that they're constantly walking around with chronic pain or with susceptibility to disease, and thus have to be very careful about masking or washing their hands or not going certain places. And a lot of people just don't understand it. They're just like, why are you being such a pussy? This kind of thing. And then now with the politicization and the Trumpites yelling at people wearing masks, and I think listener K was talking about this, that you could be wearing a mask now not in Seattle, but in other places in the United States, and people think you're attacking them with your mask.
Right,
I mean, you're not bothering anyone with your mask, but it's like a political statement to these fucking idiots, and they'll start yelling at you and bullying you, calling you like an idiot, or you're an Obamunist or something, trying to take away their guns or whatever idiotic thing they think. And yeah, so not only were these people scared and discriminated against by ableism before, but now there's this whole other level to it.
Yeah.
So yeah, absolutely. Now, might the pandemic end, listener K, and you still are suffering, in addition to me suffering and Berto suffering? Yeah, the fact that pandemics end and our suffering doesn't end, doesn't mean that if someone declares the pandemic over, it doesn't mean that our suffering is over. Like those are separate things. You don't need a pandemic to be officially declared in order to have your pain and suffering official. You know what I mean? Okay, so we're still on March 11,
right?
When the WHO declares a pandemic, and a few NBA players test positive. The rest of the NBA season is canceled.
Yeah, that's crazy.
When this happened, Berto, I thought, holy shit.
Right.
A school in Snohomish, or all the Snohomish schools shutting down for a couple weeks, or maybe a week, who knows. The NBA shut down for the rest of the season.
The amount of money involved.
Yeah.
Yeah.
Not just the team that had one of the few players test positive.
Right.
The entire country shutting down.
Yeah.
Or the entire association, which traverses.
But of course, they did the math about like one, because there's the two ways to do the math. Oh my gosh! But think about how much money we're losing. But then if their players start dying,
yeah. Well, I'd be really curious as to what was going on in that boardroom, because with the vibe of the country, the middle America, if you will, sort of average America, was not that concerned at this point. I mean, even in Seattle, schools were still open, businesses were still open. Your kids were still going to school. You weren't masking them up. And then the NBA just shuts down, And I remember thinking at the moment, wow, that's serious.
Yeah.
So I want the listeners right now, because this I think is important. I don't know why. It's sort of like, where were you when John F. Kennedy got shot or something? Where were you, and what was it that really
hammered the point home?
Hammered the point home, like, we're not in Kansas anymore, even if you're in Kansas. For me, it was when the NBA shut down.
When the NBA shut down.
What was it for? Was for you watching that video in early February?
No, because no. It was several videos in for sure, but I feel it was when the people started dying in my neighborhood at the old folks home. That's when I was like, okay, this is real. I mean, not only is it real, it's like here. It's at my doorstep. Holy crap.
Like, people are going to die.
Yeah.
Lots of people.
They're starting to, and they will continue to.
So I made some predictions early on about how many people would die. I just had a lot of time on my hands during the shutdown, and I actually predicted, I think in March or April, I was like, max 100,000 Americans die from COVID. Of course, we times that by 10, still climbing. What do you think you would have said realistically?
Well, from the videos I was watching, their prediction of the what do they call the death rate? There's a name for it, but they were saying 2%. So 2% of infections, they were saying between 1 and 2% of infections would lead to a death.
Right. I remember that science coming out. So we already had those data from China.
So I was thinking, I don't remember exactly, but if you had asked me at the time, I would have probably hand waved something and said, like, 2% of a third of the country, which would have been 100 million,
200,000,
10 million, 1 million, 2 million, 2 million.
2 million.
Yeah. So it's double than what we had.
Yeah.
But I'm totally, like, I'm not sure, but I knew the 2% number. So I would have said 2% of something, and I probably wouldn't have said 300 million because I wouldn't have thought everyone would have caught it.
Yeah.
I probably wouldn't even thought 100 million people would have caught it. I might have said something like 50 million.
So it'd be a million. So you'd have been on the money.
But now, I mean, I'm probably also.
Well, I don't know. I mean,
I might have been very off.
But try to put yourself in that mindset. Like, what would you have thought? Because I had heard those numbers too, 1 or 2%. I had also kind of lowered that a little bit because I thought, well, hopefully the United States can flatten the curve and has a pretty good health system.
But in mid-March, I'd already seen what these idiots were saying.
Yeah.
So I was like, I don't know.
But I was also thinking, even if it's 2%, we'll manage to, as people start dying as they are now, we'll take enough precautions that people just won't get it, I guess.
I remember some of the numbers that I was hearing being thrown around was 500,000. So if I had said a number, I probably
early on that number was because
well, it's not early on; it's mid-March, right?
But still, because like the experts that I was hearing, I wouldn't have said something different than very different from what they were saying.
Yeah.
And a lot of the experts were thinking along the lines of like a really, really bad, like the worst possible flu season ever. Not a million deaths. I don't remember a million deaths being thrown around until maybe even a year later.
I agree with that because the videos I was watching that were more, I wouldn't call them alarmist, just more on the money, I guess. But they were saying 500,000.
They were early.
By mid-March. I mean, again, my memory might be off, but definitely I remember the 500,000 was a number.
You were hearing that and adhering to their point of view, and they would have been right thus far.
So if you would have asked me...
You might have said half a million.
I might have said 500,000.
Yeah.
It's just that when I'm doing the math right now, if I would have... Because I actually, for my job, oddly enough, I have to do a lot of like weird estimations. So I probably would have done some mental calculus like, well, let's see, it's not everyone in the country is going to get it. Maybe out of adults, let's say half the country, then divide that by something. I probably would have come up with something. But since I was hearing 500,000, I probably would have said 500,000.
That's interesting, yeah. Because, again, I was listening to the science that was pretty scared and cautious, but conservative about what might happen. I was thinking at the beginning it would only be 100,000, which is horrific to think about. But if
you had asked me in February, I would have said probably 50,000.
Yeah.
It's just that by mid-March, I'm sitting there watching the news going like, they're doing nothing. And I'm sitting there at home going, why are the schools open? That's why I was like, I might have even said 10 million, honestly. I don't think so. But like, I was starting to get into the zombies are at the gates and no one is buying shotguns.
And you had this double edge to the problem, which is that you know, your family was still working in the world.
Yes.
Mine was not.
And
we had the ability to retract very quickly.
Yeah.
You know, all Stacy had to do was stop working at the spa, which she's self-employed, so she just gets to cancel those appointments. In fact, she, on one of the very last days before things shut down, she had a couple clients, skincare clients, that were really begging her to help them out, and she was going to go in to work, and I was like, "No, you're not."
Yeah.
And she's like, "It'll be okay. You know, they're really on top of things. They're going to wear a mask and all this kind of stuff. I'm going to wear a mask." And I'm like, "No, you're not. Don't go. That
unnecessary risk.
What purpose?
Yeah.
Like the little bit of extra money and." What, like a little bit of like approval from these clients? Who cares? Like, we could be dead, and she still did it, and I wasn't a happy person.
That's my thing. By mid-March,
but that was the last time, and we had the ability to retract,
Right.
and so for me, I was like not being aggravated because I had that power, but you're just like, please, world, shut down so that seriously, at least my family can protect ourselves.
Because remember that by first or second...
Did you think about pulling your kids out of school?
Yeah, absolutely. 100%. Because again, I was early February considering canceling a Disney trip.
Yeah.
Now I didn't.
Yeah.
But by mid-March, I would have, like, if our Disney trip was the first week of March, that would have been canceled.
Yeah.
Actually, and I think I think Disney had closed by then, if I remember right. Either way, I was at a point where I was like, no, this is heading so much worse than I thought a month prior, because before I was like, yeah, this is going to be bad. But now I'm not seeing anyone do anything about it. Schools aren't shutting down. The government's telling us that it's not going to be a problem. I was like in full red alert mode. I was on Facebook telling anyone that would listen. Like, and then
Disney didn't close down until March 12th.
Oh, okay. So I got it wrong.
Which I, you know, when you said that, I'm like, I think I would have heard that.
Okay, so you know it's funny how things happen. Where in my mind,
so we're March 11th at this point.
In my mind, here's what happened: we went to Disney, and a week later they closed down. But in reality, we went to Disney, and a month later they closed down. Right? Okay, fair enough. So
because that would have been big news,
right? And it was big news when Disney closed down. It was big news.
Yeah. But hardly anything had closed down until everything closed down.
As we've been going through this, I'm like, I probably have everything like a week off or something. And in this case, a month off.
That's what was so interesting about doing all this. It was,
but I will say,
combing through the actual dates.
I was listening because I was every day, you know, I was glued to this thing every single day.
Your phone.
Because all those videos every day were getting worse and worse and worse.
Yeah.
So.
Well, so it's funny for me to remember. So if you could have flipped a switch a week prior to this moment and had all your kids and your wife home, your home, and settle in to a isolated quarantine, would you have still been glued to your phone?
Yeah, absolutely. It's just that the difference is not only was I glued to my phone, but I was also thinking the worst was going to happen.
Yeah, because you're prone to that doom scrolling.
Yeah.
Now, for me, I'm not. And so once I got my family quarantined, I basically stopped paying attention because I'm like, I remember Stacy, because she was more concerned with it because of her spa in New York City. She had to kind of, you know, because there are all these different laws that were coming out. She had to comply because she's kind of the manager of these employees in New York. And she, I don't know, just paid attention more to this kind of stuff. And occasionally she would say, oh, so now they're shutting this down, or oh, they're now allowing us to do this and that. And every time I'd be like, well, I don't care because we're always going to be overshooting the safety precautions. 1, 2, we don't have any reason to even meet the world where they are in this moment until we're completely vaccinated and so until we're vaccinated, we're completely shut down. I don't care what the government does. I don't care what society does. I don't care what our culture does. I don't care what our president does. I don't care what my neighbors do. I don't care. Because we had friends that were we had friends that summer, people who went to a cabin in Leavenworth or something and claimed they had all not been positive. and yet their kids were still in daycare or something.
Yeah.
And I was like, and me and Stacey are like, that's ridiculous.
We're not doing that,
It turns out everything was fine with them, but I was not going to give in on any level.
Yeah.
And so for me, I was completely ignorant to like all the ins and outs by this point, because I was like, we're all online.
Yeah, I was the opposite in the sense that, like, with this is definitely a pattern that I unfortunately get into, which is I get obsessive about, well, then now what? But I also, so there's a few things that we're adding.
And we've drilled down on that before. If people are interested in the psychology of it, is that the speculation that I have for you and for many others is when you go through trauma early in life, as you did, there is a trigger that goes off in you when there's danger that causes a lot of underlying anxiety. And if you have a solution in your mind to anxiety, which is information gathering, then you will continually try to gather information as a try to alleviate your anxiety. Maybe it does a little bit, but it also contributes to it because it feeds your brain with more things to worry about. And there's
it's
the anxiety.
Take,
the anxiety never really goes away because it's a scary situation. And so you're in this endless loop of feeding your anxiety and relieving it. And there's always, like with 9/11 or with O.J. Simpson, you were also glued to the television. And so
it was one of those for me.
There's an endless supply of information and rabbit holes to go down.
And there was fuel being added to the fire because, again, I'm in the neighborhood where the biggest epicenter of deaths is happening.
Yeah, just down the street.
My neighbor is about, so maybe not yet, but is about my whole thing, it's like that. So there were a lot of things.
Your kids, your family is in known cesspools of viruses.
and every day I'm listening
meaning schools,
I'm listening to, because now the channels that I'm listening to, they have migrated from just warning that this is coming to now starting to yell about how it's here and now no one is doing enough about it, right? So I am definitely like at DEFCON, like is the higher number worse? Like whatever. I am at that worst DEFCON, And at the same time, I'm also trying to figure out, well, what else do I do to prevent this? So like, okay, so I'm going to use Lysol on all the groceries I'm ordering. I'm going to definitely wear a mask at all points. I'm going to do this. What else? If they drop off the food, how long do I have to wait? So I'm looking for all that kind of information.
Oh yeah, we as well, which we'll get into. Yeah. Let's take a break and then let's talk about the official Seattle shutdown. What do you say, Berto?
Let's do it.
So yeah, Berto, I'm guessing this is going to be like 10 chapters, like conservatively. Okay, so Seattle shut down. Governor Jay Inslee on the same day that the NBA shut down on March 11. Governor Jay Inslee, Washington State governor, bans gatherings of more than 250 people. So if you have 249,
you can do it.
You're okay. So I kept trying to look in all the research and all the news articles and the timelines and the retrospectives. When did the shutdown exactly begin?
Like the full shutdown?
Well, when we say the shutdown or the lockdown or the quarantine, when did it, what date did it actually occur?
Wasn't that like start of April or something?
No, I kind of think, when the federal government, when it became more official, but I feel like Seattle, I think like it shut down around March 11th, if not maybe a day or two later.
But I feel like my kids were still in school.
Well, let me look further down in maybe we'll get to it in my notes.
Because I remember my frustration at like, okay, it's the second case since Snohomish and the second district or whatever shuts down, and yet my kids are still going to school. I thought that lasted.
Okay. So March 23rd, which is 12 days later, Governor Inslee unveils his statewide stay home, stay healthy order.
Okay.
So yeah, that's pretty late in the game.
That's late in the game.
Stacey and I had already been basically shut down on March 9 when I got back from Tahoe, right? So yeah, so anyway, at the first governmental thing in Washington State, he bans gatherings more than 250 people. And when you think about this, it's such a laughable thing. But I remember at the time, because we've never, I don't know if in the history of our government, have we ever had anything along those lines. So if anything, it's like maybe you have to ease people into these.
And these are big monetary decisions. Those are the games and the concerts.
Yeah.
That's huge.
Yeah. You're basically saying you as a law-abiding organization cannot run this event and thus will have to eat potentially millions of dollars.
Absolutely.
And that's on you because you just rolled the dice and now you're screwed. So at some point, Stacy remembers getting a text telling us all to stay home unless absolutely necessary. Do you remember getting a text like that?
No.
I don't know when that was. Maybe it was later in this. Okay. So at this point, you're not staying at home until the school shut down.
I am. I'm working from home.
But your family is still
My family's not.
exposed.
And I am freaking out. And I am seriously coming this close to putting my foot down. But it was still weird. I was like, am I going to be that father?
Was your wife also not?
She's still working. She's still going into work.
And she's concerned, but not that concerned?
No. She is concerned, but feels powerless. Like I got to go to work.
But she didn't have to. She could have pulled
she had
some...
to.
Oh, really?
She had to because she can't just stay home.
Okay.
She's not in the kind of job that you can just stay home.
Okay.
Yeah.
Couldn't she call in sick?
Prepare for it in a way, yeah, but yes, she could have called in sick.
She could have. She wouldn't have lost her job.
Right.
So I'm just trying to gauge, like, where was she?
I guess she wasn't at the point where she was going to lie to her work to stay home. Yes.
So at this point, Stacy and I, we're totally at home now. And I'm like, you know what? Maybe this is a good thing. Blessing in disguise. Try to make the most of it.
Right.
Is what I'm thinking. Which maybe you have to skip forward a few weeks to get into this mindset of like all the aspirations and all of, I don't know if you, but I think this needs to be documented and maybe some people can relate to and remember this. It's like, okay, I'm going to stay home and maybe I'll finally be able to learn how to make sourdough bread, for example, which became a thing.
Right.
Or I'll finally organize my closet, or I'll learn Spanish or something. There were all these things that people, do you remember that? I think there's oh, really?
No, because my job got busier.
Oh.
So those first few months of the pandemic, I was working a lot, and it almost gave me a sense of purpose. Like, it wasn't working a lot and feeling frustrated about it. Myself, and I feel others in my job, we were like, all right, we got to do this.
It's interesting, because for me, obviously, I was still working the same jobs.
Yeah.
I was full-time at the university. I had my clients, I had my supervisees, I had the podcast. But what it meant was no commute and no random hours. When you're at the university, there's a lot of random hours. And so that was just free time to me now.
I work in an area that actually happened to be very important during the pandemic. Randomly, but not only, it's because like normally before the pandemic, riding in a motorized unimotor is a thing, right? Yeah. But during the pandemic, it became super important. And so
for me, my podcast became a bigger thing.
Right.
But at this point, at the beginning, I suddenly had a bunch of free time. Yeah. And so I had all these like New Year's Eve resolutions. I'm like, okay, I'm going to diet. I'm going to, get that project done.
I would have wanted to, in fact, that would have been awesome. But it became, for me, that first focus became about work and staying safe. Those were the only things on my mind.
Yeah. Yeah, I can see that because you couldn't relax yet. But so it's just interesting to contrast our experiences, because for Stacy and I, it was kind of it was a staycation in a way, and this is when we started watching Love is Blind on Netflix, which eventually led to my whole career and life being altered, which I'll get into later.
But by the way, I was trying to look through my text around that time, and I don't see anything that is like an official text message, but maybe I deleted it. I don't know.
Oh, okay.
Anyways, yeah. So I could see for you, that was actually this odd blossoming opportunity.
Oh, yeah.
Yeah.
Yeah. I like a good staycation.
Yeah.
And I was like, I don't have to deal with all those obligations. It's like, I have all this free time, and I like staying home. I like getting things done.
I will say this, though. The other thing that happened in those first few months is I said, okay, if I'm going to be working from home, and then you start, we said like, well, we got to do the podcast remotely. Well, by the way, do you know when the first remote podcast was?
I could look it up.
Okay, because since we were going to do that, and also I was going to be home and all that, I said, all right, well then I'm going to use this as an excuse to upgrade my home office. Right, and I went out and I bought some sick audio equipment.
Oh, is that when you got it?
And you and I built a computer.
That's when you bought your Shure, right?
Right. Isn't that when we built our computer, or was that later?
A little bit later, yeah.
Okay, but like during those first few months, right? Like I went out, I bought. No, I mean it wasn't just a Shure, right? I bought a camera. I did all the research on how to get a podcast quality camera. I got my mic. I got my awesome compressor. I got everything set up over the first few months.
Okay, so you did have one aspiration, which I'm going to make but that was out of necessity because...
Right, and it wasn't in March. It was like starting April through June or something,
So we might have recorded with some janky equipment in the beginning?
Yeah, I probably dialed in. Yeah, I don't remember what I did, but...
So our first remote was March 15.
Really? Okay,
Yeah.
That was janky equipment. I probably would have had to use my laptop, actually.
No, you would have been able to hook up your...
I didn't have a camera.
But we didn't need a camera. We could have just been over audio.
Oh, right. Okay. If it was
And
just
you would have
audio.
used a condenser mic or something.
Yeah, no. Yeah. Okay, you're right. For audio, we were fine.
Yeah.
But I'm saying... Right. I didn't get set up with the visual stuff until probably like June or May or something.
Right.
Yeah.
So the question I have for listeners is, do you remember what, if any, resolutions or plans you had where you're like, ooh, I'm finally going to get that thing done? I'd be curious as to what that is, because I feel like that was a cultural moment.
It was.
That a lot of people were Facebooking about, because that was the other thing, like we're all cut off. So suddenly, when Seattle has a snow,
Right.
everyone goes outside, takes a picture, posts on Facebook, and you reach out to your family. How much snow do you have?
Right.
It just becomes like this big thing. And when this happened, it was a similar thing where everyone's like, are you safe? What are you going to do? And I'm getting into this stuff. And there was, all this energy around projects, I felt.
Yeah.
I don't know when that really kicked in, but it was around. Okay, March 12, news comes out that Tom Hanks and his wife, Rita Wilson, have the virus.
Right. I remember that was a big deal. That was
Australia.
The first,
famous person. Yeah.
Yeah.
And I remember being terrified. I'm like, oh my God, please don't die. National treasure Tom Hanks and Rita Wilson. Like, that would be awful. And so that's another perspective realization, is that now if I heard, or even a year later, that some famous person had COVID, I wouldn't have thought there was a great chance that they would die. But when Tom Hanks came down with it, given what we had known, because you say 1% to 2% deaths, but I think there were some estimates that like 7-8% were dying from it. You know what I mean? I remember there were some outside estimates that were like, in some regions or some studies show the death rate is even higher than that, right? And particularly for older people, Tom Hanks being an older person.
The reason I distinctly remember the 2% is because I was getting in a lot of debates at the time, and people were saying that it was the flu, and the flu was like 0.01 or something, or it was, or 0.1 or something. It's like 0.1%. It's definitely sub 1% for the flu, for the normal flu. And I was saying, yeah, this is 2%. And they, well, that's just a little higher. And I was like, you don't understand percentages. Anyway, so it was a whole magnitude, or it was an order of magnitude difference. But people still felt the 2% sounded low. And I'm like, it's not.
Yeah.
It's not.
So there was an ageism aspect to this, which was...
right. It's old people.
Yeah. And not only old people, but old people with quote unquote pre-existing conditions, which has this, because this goes back a long time, where people with pre-existing conditions would be denied health insurance because as if it's their fault that they have a health condition like diabetes or something. And it's like, you can't get health insurance because you're one of those dirty, unhealthy people.
Gosh.
You know what I mean?
With the pre-existing condition.
Yeah, you didn't take care of yourself or something. And there's a lot of that in our culture. And I felt like there was a lot of that when people were trying to deny, particularly once it became politicized, what was really happening is like, well, yeah, I mean, old people die. And I'm like, let's imagine you're one of those old people, or one of those old people is your mom or dad or grandma or something. Like, really? So if we just went to war with a country, we would just strap bombs onto our old people and walk them across the field and suicide bomb. Like you care that little about human life.
Yeah.
That it's just like, well, they're old people, but that's long standing in our culture, the youth orientation and the discrimination against older people because they're seen as they can't contribute to society or capitalism or something. And so they're useless to our economy and thus useless as entities. And so I feel like that was going on quite a bit during this time. And that's so I can imagine why you're yelling at people on Facebook that a bit of that was going on.
Oh, by the way, I might be told, did we actually build our computer in 2020 or 2021?
It was very likely 2020.
Really?
Yeah.
Now I'm not sure at all. Now I'm thinking maybe it was 21.
Well, I mean, if you're really interested, I could look at my files because there are files that I transferred around that time. And, well, I don't know. Yeah, I'm pretty sure it was 2020 because, it's been a long time since I've had this computer. Our computers, they're not new. And remember the supply chain problem? It was like full effect at the time.
Yeah.
Anyway, so March 13, the White House declares a national emergency and limits gatherings of over 10 people. Governor Inslee orders all public and private schools closed for 6 weeks. Okay, so March 13 is when your kids stay home.
Okay, so it was March 13th, not March 25.
Yeah, I don't know where what was I saying down there? March 25 is, or what I say, it's 23 is the stay home, stay healthy.
Okay.
But the schools close.
Okay. So that means that it was the first 2 weeks of March where I was freaking out. I was like, why are we not shutting down? Why are we not shutting down?
Okay. At this point, I start bugging my parents to take precautions that they weren't taking. My dad was still golfing at the time, and he was going into the clubhouse to rent or to register and pay. Mm-hmm. Of course, golfing on a golf course, you're pretty good, but going into the clubhouse, he also was into his routine of getting his coffee and his newspaper. My mom liked to do her crossword or Sudoku or something.
And they were still doing it by this point?
Yeah, or maybe even later than this.
Oh,
and
geez.
I was like, Mom, Dad, no. Like eventually they I think realized what was going on. But I think that for their generation, they're not like as tapped into the news cycle, you know? And I'm just going to guess and say that the 5 o'clock general suburban news wasn't at the cutting edge of warning people about things.
Stay home, right?
Right. And certainly their social circle probably isn't very super informed. You and I are, constantly reopening Reddit and reading these like super specialized predictions and reports and stuff. And so I was telling my parents, and I was pretty firm with them because I was terrified. I was like, there's a good chance that one of my parents will be dead by the end of this. Remember? So that's another perspective thing.
Yeah,
it's like,
I know, right. I forgot about that.
Yeah.
The thought, like, I was convinced my dad would be because he's got pre-existing, he's a lifelong smoker. He's had glaucoma. He's got other health issues. He's by himself in Bogota, like this huge city packed to the gills.
Yeah.
Lives in a big apartment.
Like if I would have asked you, percent chance your dad will survive this, what would you have said?
I honestly might have said like 50%.
Yeah.
Yeah.
Same. And
like 50-50.
Looking back, it seems silly, but like, did you know anyone that died from COVID personally?
That I personally,
I know one person kind of, like a childhood person that I sort of barely knew who died from COVID. I don't know anyone else. And I know some of the listeners right now are like, "Oh my God, like half my family died from COVID." But
yeah, I'm trying to think because I've had a lot of people in my family and friends that passed away over the last 3 years, but I don't think any of them were COVID.
Yeah, it's weird. It's like if you would have said to me that basically no one I know will die from COVID, I would have said like, that'll be a miracle.
Yeah.
I just actually, after a 3-year hiatus of our band because of the pandemic, we finally got back together last weekend.
Oh, really?
Yeah.
Wait, which memberships?
The New York City Cops, which is
with whom on drums?
Paul.
Oh, duh. Yes, of course.
Your drummer.
Yeah. No, for some reason I was still thinking Carlos.
Yeah. Well, Carlos is actually coming up from Mexico.
I talked to him recently.
This summer. Yeah. So the bassist, Robert, said at the beginning, he's just like, he's like, yeah, it's great seeing you guys after 3 years. And if I would have thought, or no, he said something like, it's pretty amazing to think that we all survived.
Yeah.
And it took me a second. I was like, oh yeah, that's right. I remember at the beginning of this feeling like people are going to die. I have to brace for that fact. It might be me. It might be one of my parents. It might be like an aunt or uncle. It might be one of the professors at the university. It might be my wife, God forbid. It might be my best friend. It might, someone's going to die. It's just going to happen. It felt like that.
Yeah, I remember that. And actually, so one weird thing is Bogota, Colombia, was actually really good early on about lockdowns. So that really helped. But in the long run, they had tons of cases. It's just that I think by the time that they started getting the cases, it was the latter waves, like Omicron and stuff. But here also, the people in our vicinity, we also had a little bit better, luck with preparations and people following the mask and the things. But yeah, I think there was a lot of luck involved too. Like we just...
And privilege.
So
yeah, I really kind of went after my parents and basically said, Dad, you're no longer golfing. I'm telling you that is over. And my dad's... It took a second for because I've never said anything like that to my dad. That's a weird thing.
That is a big,
for me to say
dictum.
Yeah, for me to tell him what to do. I've literally never done that. And then to my mom, I'm like, I'm going to buy you on Amazon right now some crossword books and they'll be at your door tomorrow. I'm overnighting them. You're not leaving the house to play stupid crossword. Dad, I'm buying you an online subscription to the Seattle Times. You're not going to the store and buying a printed paper around other people.
Right.
COVID, 1, 2, you're old.
Yeah.
Those days are over. You're staying home. You have the ability to do it. You're both retired. You're not leaving the house anymore, Mom and Dad. And they're like, and I remember my parents being a little kind of miffed. They're just like, I don't know, not, they didn't say this, but kind of like, I don't like this attitude, but I was like, it's worth it to me to alienate them emotionally for a bit to save their lives.
I remember I had a conversation with my mom. It had to be early March because it was definitely before lockdowns. Maybe it was even February. So my mom works in the, she's mostly retired now, but she still does work in the health field. I remember talking with her, and so she's someone who's very cautious and very conservative about things and stuff. And I said to her, like, should you still be going to work? And at the time she was saying, oh, no. Work is fine. Like everyone washes their hands, people wear masks and people wear masks, not as in everyone was masked, but like doctors have, like there's masks at the hospital. And I was like, I know, but this thing is, but then a few weeks later, she was like on the ball, like she was.
Well, I also think that this older generation is more self-sacrificial.
Yeah.
So they're not very self-interested.
Yeah.
Now, I want to be clear that my parents, a month or two later, were completely on board.
Yeah.
It was just a little bit of a delay.
That initial.
Yeah. All right, March 15. Let's take a break and we get back. Let's go on to March 15. What do you say? All right, back from the break. March 15, Dr. Fauci says, the U.S. should be overly aggressive and get criticized for overreacting to COVID-19, meaning let's overreact.
Yeah, let's lead the world in this.
Yeah. Let's not even do the recommend. Let's go too far with
and this
this.
is when he starts getting the initial wave of hate.
Yeah. Inslee at this point bans in-person dining and gathering. So on the 13th, he closes the schools. On the 15th, he bans restaurants and any kind of gathering, right? So now you could argue, okay, is that when the shutdown? Because presumably, even though the schools are closed, on March 14, you could still go to restaurants and you could still go to work.
Yeah.
You know what I mean? But then March 15, he's like, no more restaurants. Now, if you're a restaurant, that's got to suck, which is another sort of thing I want to throw out there of just like how much it must and did suck for people that had businesses and livelihoods that completely were erased by the necessity of the pandemic and the shutdowns.
So I looked at some stats on that too, although this is slightly fast forwarding, but reported by July, it was 30 million reported unemployment due to COVID. And the people in the service occupations, such as personal care and food preparation, were the least likely to be paid by their employer for the hours they missed.
Yeah. And to have a restaurant and to have a restaurant in your family for 4 generations. And then because these places, they're dealing with very small margins. They don't have a huge trust fund to get them through tough times. They're just living month to month. So you lose a couple months of revenue, you're done. You close shop. You can't pay the lease anymore. And everything just goes away.
Yeah.
And that's heartbreaking.
Yeah.
You know? And
we started doing, I remember we started doing that thing where you would basically subsidize local restaurants.
Yeah.
Or I think you would pay money and they would donate food to food banks or hospitals or something like that.
Yeah. There was a restaurant unofficially that I worried about because it's a Cuban restaurant up the street. And I worried about, because I really love that place. Stacey and I really love it. And I also just thought, they don't seem like they're doing that well anyway.
To begin with? Oh, no.
You know, because it was never really crowded. It always seemed like it was doing okay, but not. And it seemed like a labor of love for the owner. The food was great, but also like not super mainstream, if you will.
Right.
And I just thought, oh boy, if a restaurant's going to go down, it's going to be that one. So I would try to order a lot of takeout from them, and I would tip them, like double or something. And I just thought, hopefully we can keep this restaurant going. It got shut down.
Oh,
yeah.
I got lucky. There's this tiny little Thai place that I actually had lunch at today, and it's just one of those literally family owned places in the middle of Kirkland. They're more like the Totem Lake area, and I love it. It's you wouldn't know it. It's in the middle of a little strip mall, but you would never stop by because it's like very small. It's got a perfect rating from the health board. The food is delicious, and I went today, and they're still open. They made it through.
Okay.
Yeah, and they have this spicy scallops noodles dish that is so spicy and so good. It's my favorite.
So along these lines, Tom Douglas, which is a local restaurateur, had to close 12 of his 13 restaurants during this time. Some of them managed to open up again, but 5 of his restaurants. So if you're not from Seattle, obviously you wouldn't know this, but Tom Douglas is like what's that German guy?
Wolfgang Puck.
Wolfgang Puck, right?
Yeah.
So he's our Wolfgang Puck, and had a restaurant. Have you heard of Tom Douglas? You know his restaurants.
I've heard of him and that he owns many restaurants, but I don't remember which ones. Which ones are they?
So the ones that are permanently closed, which are some of my favorite places that I would go to, are Palace Kitchen on 6th Avenue. Remember that place?
You had told me that closed. I remember.
Catalina Linea, Dahlia Lounge, which is which might be the original.
Oh my gosh!
And has been there for 40 years in Belltown. Brave Horse in South Lake Union, and Cuoco in South Lake Union, which are both.
Okay, so I knew 2 of those, but.
And then many other restaurants were permanently closed. There were so many restaurants that were closed because of the pandemic, but notable ones were Beth's, which I've talked about before. Borracini's, after 100 years, it was this beloved, and I used to go there all the time, Italian bakery. The Brooklyn downtown, an old steak restaurant downtown. Local 360, which I might have brought you to occasionally. I love that place in Belltown, Local 360. Okay. Bastille Cafe and Bar. I know we've been there before. Because
yeah, that's right.
that was where they
that
had,
was in the alley, right? In
that's where they had
post alley.
What's the French
Yeah,
independence?
the Bastille Day.
Bastille Day, yeah. Right. So Bastille. Steelhead Diner, another Pike Place mainstay. I think Steelhead Diner was where they shot when Harry, the one with Tom Hanks, Sleepless in Seattle.
Sleepless in Seattle, which this podcast is based on.
Feierabend, a German bar in South Lake Union that I used to love and is closed.
Oh, man.
Other places that were closed, East Lake Bar and Grill, which I loved, Tsukushimbo in the ID, which I also loved, Glow's, which is a diner on Capitol Hill, beloved diner, Seven Stars Pepper Szechuan restaurant in Little Saigon, which I also loved, the Canterbury in Capitol Hill, which I always love, CJ's Eatery in Belltown, which I love, Hale's Ale in Fremont, Paragon on Upper Queen Anne. Did you ever go there?
I at least once, man. That's sad. That is so sad.
Yeah. Okay. So they all shut down eventually during the pandemic.
But that place was very well liked.
Yeah. So, and there were a lot more places. And okay, it's a restaurant. There's other places to eat, but
there's
Seattle was already changing. I'm old, and
there's something about seeing the places that you've known for years.
But right now, there's an 18-year-old who's coming to Seattle to go to college, and they're experiencing a version of Seattle that in 30 years they will lament as it changes. So the Seattle that I adhere to was a new Seattle for someone else. So it's not like, things change, but it was kind of sucky that the 2023 Seattle is so different from the 1989 Seattle. And there were a few things that were still of that time.
Yeah.
And a lot of the restaurants that I'm listing right now were those things, and so few of those old things exist anymore, and so, it just kind of sucks. And also the livelihood of the owners and the people who work there. When I went to Beth's, the 24-hour diner that is so beloved that my dad used to go to when he was in college, I'm talking to the workers there, and I'm like, so when are you closing? Because they'd already closed and opened back up. And the workers were not happy. They're like, the owner's closing it down. And he told us that, or the owner died, and his wife actually was now the owner. They were upset because they wanted to work there, and and it was already hard enough to get a job at the time anyway,
Yeah.
Because it's not like if you lose your restaurant job, there's a ton of restaurant jobs left to have because so many restaurants.
Especially at the time where there's fewer restaurants.
Right. Okay, March 16, the Seattle Council approves a 60-day moratorium on residential and commercial evictions. Remember this?
Right.
So this was extended.
Yeah.
But remember, you couldn't get evicted.
Right.
Because so many people were without their paycheck and thus couldn't pay rent.
I remember that's so tough because if you, I used to have a place that I rented out.
Right.
And that's fine and great, but then I still have to make my mortgage payments, and they didn't put a moratorium on mortgage payments. So the people that own the places still have to make their payments to the bank.
Right.
Yeah, that was a tough time.
Right. So what would you have done if you still owned that
I would have had to eat it.
Just eat it.
Just eat it.
Yeah.
Go into debt probably, whatever.
Oh.
Just all right.
Someone's going to lose.
Yeah.
Yeah.
But I feel like what's weird about it is those things always penalize the middle tier. Because the banks never think about the 2008, right? The banks didn't end up having to pay crap.
Well,
it was all us homeowners.
Well, a bunch of people who worked at whatever financial institutions went under.
Lehman Brothers,
they all lost their jobs, but
before they got hired at the next one down the road.
But the owners still walked away with.
Oh, totally.
Yeah,
and that was one institution.
And similar with the pandemic, the upper 1% earned something like 2/3 of the wealth over the past couple of years.
So give a rental moratorium, but give a mortgage moratorium.
Right. Make the banks eat.
Yeah.
The banks have enough capital; they can lose their money.
Right.
Why does the middle class have to suffer? Yeah, absolutely. Well, Berto, the reason why is because you can't pay for a lobbyist.
Yeah,
and you can't make the politicians' lives a little inconvenient. March 17th, Antioch finally goes online.
Oh, wow.
Yeah. Antioch is a for-profit organization.
Sure.
I don't know the exact designation, but if we lose money, we go under. Like the whole campus dies. So I think there was some thinking about that. But also looking back, it's like, it's not that hard to switch to. But so here's another shift that I have to really try to force myself to identify with, which is that prior to the pandemic, if you asked a professor at my university to do an online class, even just a one-off thing, 9 out of 10 would be like, no. And 2 would be like, I don't even know how to do that.
So most people, not even counting teaching and all that, any of that, most people around the world had never done a video call.
Right.
Most people around the world had never done a video call.
Yeah. Right. So you're asking older professors who are set in their ways and are even more oriented away from technology to go online. And, I had already done a little bit on Zoom. I can't remember why. That was the other thing, was like, because Zoom became a thing in 2020, right?
Zoom blew up.
Like, if you would have asked the average person what's the main video conferencing thing, they would have said Skype. Maybe some pockets might have said Cisco, because in the corporate world, Cisco was used a lot. Oh, I know why. Because at some point I started doing more interviews for the podcast, and I did use Skype for the first number of years. And there was this other app because Skype didn't allow you to record, but there was another app that you could, as an add-on or a plugin or something, and it would record Skype for you. And then I think I lost a file or something, or the sound quality was so bad that I started looking into other things. And people said there's this free thing called Zoom that is actually better than Skype by a mile.
Yeah.
And I said, okay, well, I guess I'll do that. And then I was already kind of familiar with Zoom well enough anyway, that when this whole thing happened, it wasn't that big of a stretch. It was easy peasy. Although it still took me probably way longer than what it should have to learn the sort of specific functions of Zoom. Like I remember well into me teaching online, students were like, there's this function. And I was like, like pinning or highlighting certain people. I had no idea that functionality was there. Anyway, so March 17th, Antioch, this is a Monday, I believe, Antioch goes online. And to this day, in January, February of 2023, they're still basically online. It's almost been 3 years, even though so some classes have switched to in person, but so there are two things I think conspiring to this. One is that, or three things, and I think this is kind of prevalent not only in other universities but also in workplaces for I think some bad reasons and for some bad outcomes and for some good outcomes. One is that it is so much more convenient to teach over Zoom.
Sure.
Students and professors don't have to leave their house.
Yeah.
And they live all over the place. And you can accept students from anywhere in the world.
And they don't have to relocate.
Right. So
that's huge.
Marketing wise, you are now
an international university.
Just instantly, right?
Yeah.
So the administration is mainly interested in money. They don't care about quality of education. They're interested in bottom line.
And you can have more students too.
You can have more students. You can have more professors, because you might have a professor that lives in God knows where, and they can teach now because they don't have to come to Seattle. So and that's a pro that I'll say. And so I had students who were living in Puerto Rico, in Hawaii, and could apply, could attend classes, and and they're thinking eventually, well, I'll have to move to Seattle, but maybe not. Anyway, so there's that. Another reason is that my university was, and even our leadership was, trying to get us to be online more anyway for various different convenience reasons. Another reason is that we moved about 5 years ago to a different building. And although it was a step up in terms of the building, like it's a fancier building, it's a fancier building. So it's a real attractive building, attractive inside, attractive outside, all the bells and whistles.
But is this the one that I know?
It's on 2nd Avenue.
Is the one we did our 10th show?
Or 3rd Avenue.
Our 10th?
Yeah, it's that one.
Yeah,
Yeah.
okay, that one, yeah.
Yeah.
Yeah,
So
that's a great... I was very impressed with that.
It looks like a Microsoft campus.
Right.
And that's not necessarily a good thing when you're trying to teach a human-based science and practice.
Okay.
Our previous building was a lot more old school seeming. They've since torn it down. It's now a giant Amazon thing. But in that transition, we downsized a lot because in order to get a better place, you had to get a smaller place, right?
Because I saw both places, actually, because I feel like our 10th anniversary was at your old campus. And our...
No, they were both at the same.
Sorry, not the 10th anniversary. Well, no, because then we did a thing at a...
We did a
like
thing
modern,
before the 10th.
Yeah, that thing was at your old place, right?
No, they were both there, yeah. Same room, actually. You're just. I think you went to the old building, and you called me, and you're like, "Where are you?" And I'm like, "You're at the wrong building."
Right.
Yeah.
That's why I was thinking. Okay.
Yeah.
So I know what the outside of your old building looks like.
Anyway, so in the stupidity of this transition, we didn't have enough classrooms to accommodate all the classes anymore, and so there was also a pressure to like go online so you could relieve the pressure of the classroom problem. Anyway, and so there's a lot of pros, obviously, but there's a con, which is that you lack human connection over Zoom. To be specific about it, when I'm teaching a class, say average 10 students, and our classes are once a week for 3 hours, and we do this for people so they can have a job and a family, and it's more convenient to relegate your classes to just a spurt of time. You know what I mean? You can get your spouse or a babysitter for one night rather than trying to get a babysitter for 5 nights out of the week, kind of a thing. And so in person, it's highly interactive and very experiential. People are crying, people are laughing, people are interrupting, people are breaking off into small groups, people are chiming in. There are small group discussions. I'm roaming the room. I'm kneeling down. I'm pointing at things on their piece of paper. They're pointing at things on mine.
Yeah.
When we're doing therapy demonstrations or therapy, we're almost knee to knee because that's usually the way offices are. They're pretty small. You get the full breadth of the human being and the way they move and their body language and eye contact, Berto. Right now, you and I are talking. Right. We have eye contact. Mm-hmm. You cannot physically have eye contact over video conference. You can either look at someone's eyes on the screen,
or you could be looking at the camera, or you could be looking your eyes,
or you could be looking at the camera, they could see your eyes. But you can never have simultaneous eye contact. You can look at someone's eyes,
even though the tech now exists, but it's not available.
You'd have to have a camera right in the middle of the screen. Right where the eye...
no, they can just you can morph the face to have it be like Apple on FaceTime had launched it in a beta and it worked.
Where it morphs your eyes to have eye contact?
You can't tell that it's being morphed, but it looks like you're making eye contact.
Anyway, we don't have that, haven't had that.
Nope.
And that sucks. We're not teaching accounting or math. We're teaching human interaction, human healing, human connection. Dare I say, love. You don't fall in love over Zoom. You need to be in person. You need to experience someone. At least that's what you want to happen, right? So, and when you're on Zoom, everyone has to mute their microphones except for the speaker. Maybe one or two people could have, maybe 3 people could have unmute mic, because if you don't do that, if you've ever been on a conference call and people don't mute their microphones, it's chaos. The way that the gating works on different, because only one microphone can be working at a time. Not all, if you don't know, all the microphones aren't just on. There's a central program that will choose which microphone to highlight based on volume, because you can't have everyone talking at the same time because it gets jumbled. It's impossible to have like a freewheeling conversation. The other thing is that I think is underappreciated is that the sound is massively compressed and delayed. So you and I, Berto, we're in the same room. We can talk freely. I remember there'd be times when you and I'd be over Zoom, and even though the delay would be pretty small, it's frustrating. You know, you say something and there's a half-second delay.
Right.
It's not pleasant. Also, the two-dimensional aspect of a human being, it's flat. You know, it's not real. I'm an old fuddy-duddy when it comes to this. I'm pretty sure everyone else doesn't care, but I lament the fact that not only has the university, because now they're basically saying we're basically always going to stay online now, regardless of the pandemic. And a lot of therapists are also staying online. And I know statistics and research shows that it can be just as effective. And I trust that there are many therapists out there and professors that are able to pull it off, maybe even better. I don't know. You could argue that the professor, the therapist, the student, the client, they're more comfortable because they're at home. They're sitting in their own chair. They have their own outfits on. They could go to their own bathrooms. They don't have to commute or something. You know, maybe it improves things a little bit, but, and you know, I'll stand behind that. I'm not going to deny that. But for me, when I teach again, I will not teach on Zoom because I hate it. So I think that's another major change of culture of, there's pros and cons. And I worry that in 20, 30 years, we'll look back and say, remember the good old days when we used to meet in person?
Well, but I think it varies wildly depending on what it is that you're doing. For example, I saw my kids trying to do remote learning. And first of all, for the little one, the 4-year-old, that didn't work at all. They stopped. They canceled that.
I remember hearing about that. Like kindergarten teachers were teaching over Zoom. I'm like, how do you do That's impossible. So they stopped that.
They didn't offer it.
Yeah.
But even my older kid, who was, I guess, in fourth and fifth grade, that was not going well at all.
Yeah.
So I think there's some things like teaching that maybe, or certain kinds of teaching that don't go over well or that well. But then there's some jobs, some professions, some things where remote collaboration actually works out okay. And where seeing each other up close and stuff is neat, but not a must-have.
Yeah, pros and cons, but I worry about us.
Yes, I just think that especially when it comes to jobs, professions that are mostly on computers already, like if you imagine a project where several people are developing code for a website or something, they already are interacting mostly in the code. They leave comments in the code, they check in stuff, they check out stuff. When they have conversations, they sometimes get on a whiteboard and diagram things out or whatever. But there are tools you can do that with, right? But what's not a must-have is the kind of thing you're talking about, which is like, but if I don't see
there's
a
some jobs,
and we don't, like maybe sometimes I need to actually demonstrate a technique with,
there's some jobs where human 3D-ness and eye contact aren't critical. But even there, I worry because there are a number of different elements in our culture that have conspired to make it normal that we hardly ever spend time with other human beings. Like, it's extremely culturally normal that when your friends or family annoy you, that you just avoid them for a while, you know, that or if you have roommates or family members that you're living with that are getting on your nerves, that you move out and get your own place. It's a breath of fresh air, right? You're just like, I don't have to deal with that anymore. Yeah. And you're now on your own. You're in your own apartment. You're in your own space. It's your mess. You don't have to deal with other people's shit. It's convenient. It feels better in the moment, just like a bag of Doritos feels good in the moment. Sure. But ultimately, I don't think it's good for us. And there are plenty of other cultures around the world that haven't made those transitions and aren't as miserable as Americans. And so I worry.
I hear you. I do think pods, family unity, and not only like the nuclear family, I think extended family unity is important. I think that in-person interactions are still important. So even in the cases that I was describing, if I could wave a wand and arrange how I think it should be, is you still need some frequency of in-person contact. I'm just saying that there is some kind of work that lends itself better for remote.
And I'm not disagreeing with that. Yeah. For example, there are some people, particularly in other cultures, where they don't have a car and there's no public transport, so they walk a couple miles to work every day.
Right.
They're healthier, they're happier, they live longer, their marriages are better.
Yeah.
Their sleep is better, their cognition is better. But if you gave that person an opportunity to take public transport or even gave them a car, they'd drive themselves to work. So there are conveniences that feel good in the moment that ultimately harm us. And I absolutely will stand by the cultural shift to Zoom will, on average, be yet another cultural shift that is leading to us being even more miserable.
I will say, from a family point of view, there's no question. It's irreplaceable, the being in person part, because like my family in Colombia, we did tons of video calls during the pandemic. Tons. We saw them a ton. It doesn't matter.
Yeah.
It was the moment I finally got to see him after 3 years.
Yeah.
Because it's all the little things. This is what you're just in the room, and they're there.
Yeah.
And then you can hug.
It's completely different.
Touch a hand.
Yeah.
You can look in the eyes. That's irreplaceable, right?
Yeah.
Yeah. So from that perspective, no question. Let alone, I was thinking as you were talking, I'm like, well, what about a lot of the therapy that we've explored in episodes a long time ago, like the physical therapy, yoga therapy, or
dance movement therapy.
Dance movement therapy. There's so many therapies or improv therapy that would actually benefit from in person.
But right now, there are a lot of dance movement, a lot of art therapists, a lot of yoga therapists that are doing it over Zoom.
Over Zoom. Yeah.
And I'm not going to say it's not as good, or it's a bad idea. Bob, my other co-host, is completely over Zoom, 100%. He's a great therapist. I'm sure he's helping a lot of people. And I'm just an old fuddy-duddy. For me, I couldn't stand Zoom, and with my clients did phone, because I'd occasionally done phone sessions with people prior, and I was comfortable with that. Because there's a downside to phone, but I find it far superior to Zoom, which is very weird. So I'm a weird person. Do you know what I mean? Like, I'm a very odd therapist, a very odd professor.
Hold on, though, because there is research that shows that in a video call, the audio is more important to people than the video.
Really?
And what I mean by that is for quality specifically. So, for example, if you're doing a video call and the video is a little choppy and stuff like that, you're gonna not love it. But if the audio is choppy, you cannot have that video call.
Right.
So if you think about it, like, whenever you're doing a thing, if you're done. Yeah. Oh, I got to call you back.
Yeah.
But if the video is a little bit like that, you'll put up with it to a certain extent.
Or even if the video just goes out.
And if the video goes out, you're still talking.
Yeah.
But if the talking goes out.
Interesting.
So I don't disagree with that. Like, if you have a phone call and you can just focus on what you're saying, that can be very, very useful. Mm-hmm. The video adds a different dimension, but I was thinking back about our D&D sessions. Mm-hmm. Like, doing an in-person D&D is so much cooler.
Yeah.
When we did the last D&D thing we did, it was amazing, and it was a great experience. But more than anything, I felt like I was performing for the camera. Mm-hmm. Whereas when we're in person, it's really a lot more communal.
And maybe it's, again, an old fuddy-duddy thing, but when I'm in person, I feel so much more relaxed in my skin. Yeah. When I'm over Zoom, I'm in a constant state of like, am I in camera? Yeah. Do I look weird? Because that's the other aspect they've done research on, is that if you actually delete the ability to see yourself, it makes it a lot more enjoyable. Because how often are you sitting there talking to your friends or at work with a mirror right in front of your face?
Yeah.
Like, you never see that.
But, so there's just some weird etiquette with this. Like, so now it's been 3 years of me being nonstop in conference calls for my job. Yeah. And the weird thing is that I like to turn off my camera because of what you're saying. But oftentimes there's pressure for you not to turn off your camera.
I know, yeah. There's a whole etiquette.
And you're like, but why? Why do you need to see me right now?
Well, because I don't know about the culture of your meetings, but so what I observed was at my university, well, one in my classes, well, God, there's so much I can say. God, so this is another aspect of the pandemic, I think, of just like all of the culture around Zoom and the thoughts. Because if you would have asked the average person, including me, what I thought about Zoom in 2019, I'd be like, I don't know, it's a conference call, who cares? But it became really a part of our lives. Just as a side note, in the beginning of the pandemic, of course, we did all sorts of conferencing with family, with friends. We tried to play poker over Zoom. And after a couple months of that, I found myself not wanting to do it. And then eventually I realized it's almost a net loss because it's so hard to communicate with everyone over Zoom. You know, there were things that you had to, like, for Christmas, of course, we have to do a video conference with, and I enjoyed it with my family, but we didn't do it recreationally after a certain point because it was so hard to have it feel good.
My older kid was traumatized, and I know she wasn't the only one, traumatized for a while after having had to do the online teaching remote learning. She didn't even want to do the calls to Colombia anymore, just to talk to the family. Because she would say, I hate video calls. I hate video calls.
Why did she hate it?
Because I think the school thing had like traumatized her. Like she felt it was like this weird oppressive thing.
Yeah.
And that was a common thing you would hear about Zoom fatigue.
Yeah.
You know? Now, for me, I have been doing in my line of work, like, you know, for 15 years.
So wait,
now.
so when you're on did you ever do a conference call with 8 different cameras from your family?
Yeah, definitely, yeah.
And that doesn't drive you nuts?
Yeah.
Oh,
Of course. But that's different. That because everyone's being chaotic. They don't know how to hold the thing. It's people are talking over each other. Yeah, that's chaotic.
they don't hear you.
They don't hear me.
You'll
Yeah,
say
absolutely.
something and you'll get cut off from
that
someone
one
else.
That I totally agree. But I'm talking about even just calling like my grandma or my dad, just one person. My daughter had gotten to the point where she didn't want to be on camera anymore.
Yeah, totally.
Whereas for me, it's different. I have been on camera for work, obviously not full time, but I have been for 15 years. Like
really?
We've had video conferences for well over a decade.
Yeah, if I never go on Zoom again, I'll be happy, honestly.
Yeah.
Like before the pandemic, I actually kind of liked Zoom because it was a better thing than Skype. So,
Yeah.
but pandemic halfway through it was all the work at Antioch. It was all the meetings. It was all the classes. Yeah, if I never go on Zoom again, I'll be happy. Yeah, what I was going to say was I noticed that at my university, there's not a lot of men who work at the university. It's a lot of women. And in meetings, I would notice that I would often turn my camera off, and I would take note of who else did. And it was pretty rare that other professors would.
Interesting.
And if there was another professor that did, it was also another guy.
Oh.
So I think it is socialized into men that we have that right or something, that we have that privilege to check ourselves out or not participate, not be polite, I guess.
Okay.
Like we're not beholden to the caring about other people's feelings, because the cultural premise was that by turning your camera off, you're kind of tuning people out, or it's assumed that you might be kind of like doing something else, you know.
Right.
You might be walking around the room, or you might be emailing someone, and you don't want to make it known that you're doing those things, and so you're turning off your camera, right? I mean, why would you turn off your camera?
Well, so I have 3 main types of meetings that I participate in. There are meetings I run. For those meetings, I definitely have my camera on, and I'm usually making eye contact to the camera and stuff.
Right, same. Or no, I never would do the eye contact to the camera. That was too weird for me.
Okay, I'm not going to go that far, but
what I would try to do is I'd try to scrunch all the people's faces close to the lens of my camera.
Yeah.
So at least I wasn't looking that afar.
Yeah. My point is I'm very present and very engaged with I'm presenting, right? Okay. Yeah. The second type of meeting is one where I'm not presenting, but it's a small set of people and we are in an engaged conversation. In that case, I normally will keep my camera on unless there's going to be someone else presenting for an extended period of time, in which case I'll switch it off for a bit. And then there's a third.
Why do you turn it off? Because I think this is interesting. I think it's like a weird psychological thing.
Mostly because if I were in a physical meeting, I wouldn't want everyone staring at me the whole time. So there's this weird self-conscious thing. I'm like, well, I don't want you staring at me the whole time.
Because you're self-conscious.
And narcissistic. Because they're not going to be staring at me the whole time. Right?
Right.
Then there's a third type of meeting, which is a large meeting, like a lot of people, and I'm not presenting, in which case I'm like, yeah, I'm definitely not having my camera on.
Why?
Now,
Why?
I usually turn on my camera, say hi, and then turn it off.
Why do you turn off in that situation?
Because now I'm definitely like, why the heck do you need to look at me? Like, what information is my face going to give
Well,
me?
but the other side of things, I don't know if this was present in your culture, but in mine, it was more respectful to nod your head or to laugh or smile when.
But there's only so many people visible at any given time.
But
so
if you're,
fine, I'm delegating the pleasantries to someone else.
Yeah.
Yeah.
So I just think it's an interesting thing that was happening for me and a lot of us from, behind the scenes of just like, do I leave my camera on? I'd rather not. I imagine most people would rather have their camera off. Like as a professor in the beginning, I think I was pretty encouraging people to keep their camera on if possible. But eventually I started in other situations where I was not the leader, feeling really oppressed by having to keep my stupid camera on. And so I started turning my camera off, and
right.
and I was paying attention, but a lot of these meetings I did not have to pay attention, you know what I mean?
Yeah.
And so it was almost like a way of self-preservation, but also like, if they're going to waste my time, I'm not going to waste additional time by staring into the camera. You know what I mean? Because this meeting is so mundane and
right.
dumb. I'm not going to just be sitting here quietly still staring at the camera when I absolutely could be doing email or walking around the room or playing with the cat or something.
The funny thing is, because I use a laptop. And with my laptop...
Oh, so you don't use your setup for your work meetings?
I use my laptop.
Huh.
And what's funny with the laptop is you being in a meeting with a camera on and paying attention, and you being in a meeting with a camera on and doing work on your laptop
is the same. Yeah. So now eventually, though, about halfway through this whole thing, I eventually started telling students at the beginning of class, which I gathered was kind of a rarity among professors, which was that I said, if you want to turn your camera off for whatever reason at any time, do it.
Do it.
Like, don't worry about it. And in fact, I think my program even made it mandatory that students had to keep their cameras on, because it was starting to become, I guess, an issue for some professors that like half the students had their cameras off, and it felt like half the students were really paying attention or something. I just got to the point where I was so fatigued with Zoom, and also just like, look, it's your money. If you want to pay attention, pay attention. If you don't. Yeah. Just don't distract the rest of us. If you have to turn off your camera. I had students that were literally drinking alcohol during class openly. You know what I mean?
Oh my God.
Like a glass of wine on camera because they're at home.
Yeah.
And they don't have kids. They live by themselves. And the classes are from 7 to 10 sometimes. So It's just like, they're having a glass of wine at night.
Yeah.
And I don't know. It was just, at some point, it was just such a chaotic, horrible situation. I'm like, look, we all got to survive. And if you're more comfortable with your camera off, do it, because I'm not going to hold you to it. But it's just funny to remember that time for me and maybe I'm guessing professors are still going through it. I'm guessing I would still be going through it if I still was teaching. I plan on teaching in the future in person, but it's just interesting that we would, and I know there were a lot of talk about this, of like developing etiquette and culture around video conferencing.
Yeah.
Right? Like, do you use a green screen?
Oh, yeah.
Do you wear pants?
Right. Do you have to wear pants even if there's no one there to hear your tree fall?
Yeah. Yeah. I mean, along those lines, I don't know if you've noticed, but I always wear shorts now. All the time.
I've noticed you when I come over wearing shorts.
Summer and winter alike, I am wearing shorts.
Yeah.
And so I guess if you've lasted this long in the episode of chapter 3, I'll reveal that in the reaction videos, 99 times out of 100, I'm wearing shorts.
Dun, dun, dun.
I'm not wearing pants.
Now they have to go and rewatch all those videos and imagine that you're wearing shorts.
And the shorts are real short shorts.
They're short shorts. Who wears short shorts?
Like, most of my thigh.
They're 80s short shorts.
Yeah. these shorts get comments from people when I wear them outside the house. They're like, "Whoa, that's a lot of thigh."
Like, oh, you're walking around in your underwear. Oh, wait, you are wearing shorts.
Yeah. So that was another cultural change.
Yeah.
Of what does it matter? I'm going to be comfortable. I'm more comfortable in shorts.
Right.
You know. So, well, I don't even know how many days we got, Berto. But let's just end March and then adjourn. I'll just rip through it. Okay. And then we'll know to start with April.
Yeah.
With chapter 4.
That's a good break point.
So choir. Okay. So March 17th, Monday, Antioch goes online. I'm sure you remember this news story that a choir practice in Skagit County in Washington, they like ignored the restrictions.
Oh yeah, I remember this.
And they had a choir practice, like 30 or 20 of them on March 17th, guessing that Skagit County, more Republican, this kind of thing.
Yeah.
Right? 87% of the choir got COVID.
Oh my God.
And 2 of them died.
No way.
Yeah.
Oh, I didn't remember that they died.
Well, that wasn't the immediate news story because it took a while for them to die.
I just knew that they got massive outbreak of it.
And it was this big joke. It was like, you idiots, why are you having choir practice?
She died?
Yeah.
Were they older? Like, was
I don't know. Does it matter? Doesn't matter.
I mean, it only matters as in like the odds, you know, like.
Yeah.
Wow.
Well, they could have adhered to Governor Inslee's order that you couldn't have gatherings.
Yeah.
You know, on the 15th, he banned in-person gatherings.
Yeah.
You didn't need to have choir practice. Okay, so March 19, this is when we did our first D&D podcast over Zoom.
That's soon?
Yeah.
Wow.
We just had one scheduled, I'm guessing.
Okay.
Everyone is talking about quarantine this, quarantine that. I actually had a video where I posted or a picture or something I posted on Facebook, and I said, this is how we're doing the quarantine, because everyone was doing that.
Yeah.
People were like cozy with their dogs.
Right. I remember that.
Or
that trend.
Working on a project, this is what I'm doing.
It was at that period of time where people were still thinking like, oh, fun, we're going camping for the weekend.
Exactly. That's what I wanted to capture, was that feeling of like we're all going camping as a town together. In fact, there was a Seattle hashtag we got this. Do you remember this?
Oh, I remember that. Yeah.
Yeah.
We got this. 2 weeks. What's the big deal?
We got this. We'll work together. Because it was a thing where we had to work together.
Yeah.
If the idea was at the time that if we all shut down, that the virus would burn itself out and then we could all emerge. But if anyone fudges the rules, then it'll continue.
Right.
Turns out that wasn't we'd have to literally shut down the entire earth, which isn't possible.
And for like a month.
Yeah.
At least.
So
I do remember thinking through that though. I was like, well, if I understand correctly, the virus doesn't survive randomly on surfaces indefinitely. So in theory, if you could isolate everyone for like 6 weeks, the thing probably would die off.
Right. I remember thinking that's what it was looking like we were going to do as a nation. And theoretically, if the entire world were to do something like that, it's possible. I mean,
well, and actually, okay, so to be fair, in some countries, they literally shut out travel.
Yeah.
And in those areas or some areas of the country, like I just had a friend who lives in Australia, not the one you met, different friend, lives in the other side of Australia, was visiting, and I had lunch with him today. And he was telling me that in Australia, in his part, they were extremely aggressive about shutting down. Mm-hmm. But within their area, they were kind of free to roam, and it wasn't like
right.
And they had good results with that.
Right, at the beginning.
Yeah.
And so it isn't. I wonder what the theory is around that. I'm guessing there will be think pieces about this. That is it possible? Because maybe that's the answer moving forward, or at least to experiment with, was as a world, and everyone has to play along.
Right.
Maybe it's not even a month. Maybe it's 3 weeks. Who knows? And only certain things are allowed to happen. Like you need someone to run the electrical grid.
Yeah.
You need someone to fix the sewer line if it breaks or something. You need, if a crime happens, you need police to respond.
This is the devil of the details that actually ends up being the reason why you can't quite pull it off.
Why?
Because of all the exceptions you end up having to make.
But I wonder if you could add an additional layer where if one of those free to roam individuals were to be tested 3 times a day, you can isolate.
Yeah, I mean, no, in theory, sure. Like hypothetically, you could design this perfect set of things that might work, but then there's humans involved.
But that's right. But maybe in 50, because this isn't the end of it,
right.
and as soon as we come out with one solution, another bug will be able to beat it.
Well,
so
yeah.
So who knows? Maybe
I will tell you this: if the mortality rate had been high enough, that's exactly what would have happened.
Because people would be dead.
We would have no choice.
Right. Well, but I never thought of this. And I wonder if people are thinking about it. That say if we have 4 more pandemics similar to COVID-19, that at some point it'll start to get floated. That as a world, if we all work together as a world, we might actually be able to snuff out the next pandemic if we shut everything down.
Kill the virus in vitro.
And there will be suffering and there will be economic downturn, but think of the benefits. We'll be able to go back to normal afterwards.
Right.
I mean, all sorts of things might be eradicated in that time. Like regular flu will just randomly die out, and the only way we could start to get viruses back into the population is if
new ones
develop by cross, from other animals.
Well, and that's just it. Like there will always be new ones, but if we're talking about an individual pandemic, it is true that if you can just let it run its course and not keep transmitting it,
it'll die out.
Right. Yeah.
So at this point, Trump has a recorded conversation with Bob Woodward, the famous journalist. This recording would later be made public in September.
And it's at this time when it was?
When Trump tells a journalist on the record that he always intended to play it down, COVID-19, meaning that he knew it was a big deal.
Right, he had been told.
And was trying to trick the public into believing it wasn't a big deal.
That was as clear as day, obvious.
But the fact that he, at this point, was not even deluding himself. Do you know what I mean?
That is a good point, because oftentimes big liars, they're effective because they start convincing themselves of that reality.
Right.
But what you're saying here is like in that time, he's like, no, I know I'm lying.
Yeah, this is mid-March. He's saying, I have been for the past couple months, when the time came, I always intended to play it down, and I'm doing it right now.
And he's thinking he's doing it to be the savior of the people, because like he can't be
savior of himself to get reelected, to be clear.
No, I think he's probably small and narcissistic enough that that he's like, I'm saving probably the world, actually. Because if you think about it, he doesn't just see himself as like I want to get reelected because I need more money. I think he sees himself as like the greatest, period. And so I'm guessing if Bob's like, well, why are you doing that? He's like, well, because I'm protecting everyone.
I don't think he would even say that. I don't want to be one of those people that vilifies him, but I would think he might twist it to say that I'm saving the economy because I'm the best at all things economy, and I know that the economy is the best thing, and all my friends are the best with economy, and I'm even better than that. And so the economy.
Like, just extend that. Just like,
I need to keep people working.
Like, look,
he might extend that to, and maybe that benefits society and people, but I don't think he thinks like that.
But do you think he thinks people are smart? No. He thinks people are dumb, and he's the smart one.
Yeah.
So he's probably going like, I can't tell them the truth. They're dumb. They'd freak out. I don't want to start a panic. People are stupid. They'll panic.
I wonder what, I do wonder. I can't imagine him saying those things. I imagine that he was so bent on getting reelected, and he just had a single-mindedness of, I need to keep the economy from tanking. I need to do everything I can to keep the economy going. It was going well. If it starts to tank, I won't get reelected. I need the economy to continue. I'm guessing he also thought that it would blow over, as a lot of people did. And yeah, certainly a lot of older people will die, but they don't matter to the economy. I don't know if it went much beyond that.
But like, if you think about, like, it's the same thing with all the topics. If you ask them as a reporter in just a silent room with just the two of you with no cameras or anything, why did you talk about the wall, right? Like, yes, he would probably say like, well, because it's an issue that people care about, right? But it's also, he's the savior, right? He's the greatest person alive.
Yeah.
So he would also say something like, oh, it's true though. All those people are trying to come through. So like,
yeah, it is curious. It is interesting, because those conversations don't usually happen.
Yeah.
He would absolutely, about the wall, he would say, hey, a lot of people are really concerned about the rapists and the drug dealers.
Yeah.
But I don't know if he actually cares about those people.
Well, that's why I'm saying, like, the lines get blurry between what he actually believes and doesn't. And the example is that quote from earlier, or the other episode, where he was going in the middle of a conference about the tests that are getting rolled out. He's talking about how smart the scientists think he is.
Yeah.
So that's why I'm saying, like, I don't think he's putting that much thought into it, right?
Yeah.
So my hypothesis, but I'm not going to die on this hill, it's just when he's saying like, well, I was downplaying the pandemic. I actually don't even think he's going through like the extended math of like, well, because see, my master plan is like, I downplay it so that, the economy is strong so that I get reelected. I'm literally thinking that he thinks it's the best thing to do for people.
Yeah,
but
I don't know. It's an interesting thing.
Maybe it's one side of the same coin.
And again, I obviously am biased.
I'm actually not even trying to defend the guy, right? I'm just saying, I'm.
And I don't think, and for the record, I actually don't imagine if I were to evaluate him, I would find that he was a psychopath, for example. I think that he does have the normal baseline level of empathy for other human beings, but I think he is, but it's impaired, I think, by his extreme need to be the best at all things and be seen as the best of all things.
Yeah. And the thing is, if I imagine, well, what would I have wanted a leader to say and do? So here's what I don't need. I don't need a leader to necessarily have a press conference where they actually tell me everything. And the reason I don't want that is because in reality, not everyone is going to react well to all the data at all times.
Okay.
At the same time, what I also don't want is someone to massively mislead the public.
I see.
Knowing full well that they're misleading.
So you're saying he's thinking, look, it's for their own good, because if I tell them the truth, they're going to freak out and everything's going to fall apart.
And then to your point, and then the economy goes down,
and then they're going to suffer.
Right.
Yeah. Okay.
But who knows?
That's the most charitable thing you've ever said about the guy. I'll get it. So at this point, therapists are scrambling to go online. I talked earlier about how professors didn't know what they were doing. Well, therapists, even more so, probably don't know what they're doing when it comes to going online. And so most therapists have never provided online services,
right?
Have never done a phone session, even don't even know what Zoom is. I remember well into the pandemic, there was like news stories about there's this new thing called Zoom, and I'm like, no, it isn't. It's fucking old, but to you, it's new. And so it was a lot of that. And technically speaking, in order to provide online services, you need to be trained, you need to be supervised, you need to. It's not just like something you can just do as a therapist. It's like a specific skill set and ethical knowledge that you have to acquire. And suddenly every single therapist in our country and maybe around the world suddenly had to learn these skills.
Yeah.
And also clients suddenly had to learn how to use Zoom as well. It's not just the therapist. Like you have people that might not even have a computer or, so I, in an effort to help with that, had 2 episodes at this time in which I had ethics and legal experts come on the podcast in March 23rd and March 27th, talking about practices in law and ethics.
Oh, interesting.
Yeah. And I'm like, was I already planning on that, or did I just suddenly throw that into being?
You must have, yeah. That's great that you did that. That was very early for you to do that. That's
it's
awesome.
really, that's the other thing is to looking at this timeline, it's like things went so quickly.
They really did, though, because that was the thing you were saying earlier, where like the time dilation and compression during that whole time was weird. Yeah. So, if I were to say the Seattle shutdown was on March 15th when
March 15th, when Inslee bans in-person dining and gatherings. Because clearly 2 days later, when we hear about the Skagit County choir practice, we're pretty pissed off. I remember everyone was like, "You idiots!"
Right.
And this is before anyone had died. So if we say the 15th is the shutdown, then if we rewind the clock back to, I think, March 9-ish, Antioch is still doing in-person classes.
Well, so if you had asked me just kind of randomly, hey, how long do you think you were stressed out and yelling at the wall that they hadn't shut schools down? I probably would have said 1 month, but it was only like a week and a half or 2 weeks.
Yeah.
Right?
Yeah.
Because I wasn't doing it in February yet. I mean, obviously I was worried and stuff, but I wasn't like, they should shut down schools in February.
Because he shut him down on March 13th.
Right. But at the start of March, I was definitely doing that. So at most it was 2 weeks.
Right.
But I would have said, oh, it's like a month. I was yelling about a month.
Yeah. From the time it was absurd to think about a shutdown.
Yeah.
To the time where it was absurd to not think about a shutdown. It was like 2 weeks.
Yeah.
And not just the perspective or the changes, but the cultural shift.
Yeah.
That I remember marveling at that. I remember marveling at how, because if you would have said, in 2 weeks, everything is going to shut down and no one's going to be able to leave their houses unless they're allowed legally because they have a specialized job, I would say people's minds would literally explode, or they would protest, or they would cry, or they would just all start to kill themselves. Like, it would just be utter chaos.
Which is why I started actually feeling a sense of hope at the beginning there.
Because everyone was doing it.
Yeah, because I quickly remember feeling like one day I'm feeling like, is no one listening? To like the next day, like, oh, okay. Oh, okay.
Yeah, you must have been really happy at that.
Yeah, I was like, all right. I'm working from home. Everyone else is here.
Yeah.
I'm ordering stuff online. Things are getting delivered.
Now everyone has a aluminum foil hat on their tin foil.
Yeah.
So March 21, record sales of alcohol. Do you remember this?
Oh, yes. Yeah, totally.
Yeah.
Because it's like, well, what are we going to do?
Yeah, I remember Stacy and I, we, probably had a bottle of wine or something at some point around here. And I remember being like, oh, this actually kind of feels fun. We're at home and having a couple drinks. And then when this story came out that it was record sales of alcohol, I was like, oh yeah. Like, it's something to pass the time,
Yeah.
Plus,
totally.
like, you're not going out anymore.
No, so that's your
only... you gotta bring the bar to you.
You know what? I just had a thought on the flip side of that is how unceremonious it was that I didn't get to see people for so long. Meaning, like you said, hey, that was the last day we podcasted together. That's the last time we saw each other for. Now I'm looking back. I guess I was too busy worrying or whatever. I never even remarked. I don't remember actually going through and like, oh my gosh, I will not see Ron.
We didn't know.
Right.
Because we thought it'd be 2 weeks.
Right. Same thing with my mom. Like so. That's crazy.
Because that was another thing. Is like every 2 weeks.
Yeah, that's true.
It just became another 2 weeks.
That's true. So that is why I didn't have that moment of like, this is it.
Yeah.
I'm not going to see you for 2 years.
No. Right. I mean, you and I have gone a couple of weeks without seeing each other.
Easily.
So
I've gone months without seeing friends.
Yeah. So it's like, who cares? Like So March 20, the Olympics are scheduled for August.
Oh, right.
And they're postponed.
Oh, at this point?
Yeah.
Oh, I thought they weren't postponed till like May.
No. So early, which is interesting.
Oh.
That's interesting that the Olympics in Tokyo, now they've had COVID longer.
No, I know, but what I'm saying is another one of those time dilation things. I remember thinking for a long time, I can't believe they haven't postponed the Olympics yet.
Yeah, they pretty early, I would say. I would say pretty because it was scheduled for August for 6 months, 5 months later. The Olympic Committee had that much forethought, because if you would have asked me, I would have been like, we'll be fine by August.
So you know what must have been happening is every day, that was, I'm sure, one of the topics in those videos, like, and they're still not postponing the Olympics. So in my mind, it was months where they weren't postponing the Olympics.
March 23rd, Governor Inslee unveils his statewide stay home, stay healthy order that prohibits all non-essential in-person activities and businesses. So up until this point, quote unquote gatherings were forbidden, but now they're like, look, unless you absolutely have a reason
Right.
to be outside of the house, you're forbidden from leaving.
That's crazy.
At first, it's just for a week, but it kept getting extended until June 1. So another aspect of this, as I was going through the events, was that the actual legal shutdown was actually pretty short. For me and Stacy, it lasted until we were both inoculated from the vaccine a long time later. So the official shutdown was mid-March to June.
So I've actually thought about that as well, and it is so frustrating. As an example, Joe Rogan last year, I forget, like maybe in June, somewhere in the summer last year, he on his podcast said, "Oh yeah, you got to vote Republican because you saw what happened. You don't want those kinds of shutdowns. You don't want." And I was thinking to myself, I was like, "Wait, was it really that long?" Because I know that us, and we were even less than you, but we were self-imposed more than was required. But I didn't even realize it was that short.
Yeah.
If you had asked me, I would have said, well, it was all through 2020, I'm sure.
I mean, there was a phased opening at a certain point,
right.
and it wasn't like suddenly everything was normal. It was like, and we'll get into it later
But I remember it like it was all of 2020.
Yeah, if you would have asked me, I said we were shut down until we were vaccinated.
2021.
But officially, I don't think so.
So that's what really pisses me off, that people would be like, I can't believe we overreacted so much. What are you talking about?
They're saying we overreacted.
Oh, totally. Absolutely.
Idiots.
That the country went insane with overreaction.
So
that we should learn from Florida.
The one data point, one datum to demonstrate that's stupid is the flattening of the curve for the hospital's sake was important. Even with what we did, the hospitals were still turning people away in some jurisdictions. People were dying even of other problems that had nothing to do with COVID because there was no availability for help. That is horrible.
Yeah.
There weren't enough ventilators. Plenty of people died because they couldn't get on a ventilator at this time. So we were doing everything we could to relieve the hospitals of what was happening. It wasn't like it was an overshoot. It was a too late of a shoot, and it was doing the bare minimum to staunch the bleeding. Plenty of people still died. You know what I mean? So it wasn't an overreaction. What an idiotic thing to say. What an irresponsible. Is he still saying that shit? Because I thought he learned his ways. This
was in 2022, man.
But was this before or after Neil Young and all that kind of stuff?
I don't know.
Because at some point he was blasted and he apologized, and I had heard that he changed his ways.
I'm not sure. I used to listen to Joe Rogan a lot, and I stopped when that stuff, and he started, there's a few things like that where I was like, I don't know. Kind of done.
So the last thing I'll say, and we're not going to get through March because we're just not, is Puzzle Mania was a thing.
Puzzle Mania? People were solving puzzles at home.
You don't remember that?
Well, we did. I didn't know that it was a thing.
Oh, yeah. Because it was, again, that cultural, we're all camping together thing.
Oh, wait, no. Because they were posting on, I remember now, on social media, people were posting their puzzles.
Yeah. Trying to get puzzles, trying to buy them on Amazon.
They're all sold out.
Oh. And we actually randomly had a puzzle that we were wanting to work on. Home. But we had almost no puzzles, and Stacy and I spent a few days making. It was a montage of 80s figures and events, and it was really fun. You know, it's like,
fun.
Oh, there's Michael Jackson, there's Bruce Willis.
It's like, where's Waldo?
It was kind of like that, yeah. And there's the Challenger explosion. There's this, and so we the only puzzle I've done in 30 years was. During this time.
Wow.
So it's a puzzle to me, Berto, why we are only on page 9 of 48 and we've already been talking for 6 hours.
Because it was the biggest thing of our lives.
I know. I feel like there's still so much to say.
Yeah.
And I worry that the listeners are bored out of their minds, but I have to do this, Berto, with you.
Yeah.
And I feel like the listeners probably at least 10% wise, they're getting a little bit along these lines. And
let's put it this way. The ones that need it need it.
Yeah.
Need this kind of thing.
Yeah.
Like us. I need this. This is good.
You do?
It's therapeutic. Yeah.
For you too?
Oh, yeah.
How so?
Because like two things. I think in this one or one of the earlier ones, I was saying that this makes it real. This means it happened. Because I'm actually like, that's right. When you're giving me some of those dates, it's making me remember things. I'm like, whoa, right. And then it feels like I actually lived
Next
through
time,
it.
Berto, speak up. Because don't be shy.
Yeah. And then there's another aspect to this, which is you and I lived parallel lives during this. Well, you podcasted, but I didn't see you in person. And I think through this, we're going to start filling in all these other little things. Like,
true.
Whoa. And then what were you feeling? What were you thinking?
Yeah. I didn't know any of this detail that you're telling me.
As an example, when you started that, which I know you'll get into, when you start doing your reaction videos and all that stuff, I didn't know at first. Like, that wasn't something, because it's just so interesting. And even the fact that you were even watching those shows or whatever.
Yeah, we're not even to that point
No.
yet.
So there's going to be all these things along these times where you wouldn't naturally see the other person. And in our case, we actually saw each other unnaturally more than normal because we were podcasting.
Right.
There were friends that not only did I not see them in person, but other than a random text message, I probably didn't even hear their voice for 6 months, 9 months, something like that.
Right. Yeah, it is interesting when you say it like that, it's like we're finally catching up on what our lives were like this time, because it was so chaotic and
like, dude,
and we didn't really check in this way. It's interesting that we didn't, it's interesting that we didn't make an episode during the shutdown about the shutdown.
Man,
we just continued to make regular episodes. I'm just trying to think of, I'm going to look up what episodes I actually made back then.
Not only are you 100% right. So I was looking at my videos that I put out. I thought I had been putting out videos about the pandemic. No. My first video after taking a long break was a reaction to your reaction about 90 Day Fiancé.
Yeah.
Which was well into June.
Yeah.
I didn't make a single video myself about any of this.
We made an episode on March 16 in which I labeled it COVID-19, but also there were other things. So I think it's of the emails, and then the telehealth episodes, coronavirus, toilet paper hoarding. So we talked about that with Bob, I think. We talked about Love is Blind. I think you and I talked about it for a bit. Oh, coronavirus anger. Okay, so there, coronavirus anxiety management. So it looks like,
but that's different. Like, well,
but at least coronavirus parenting. So there's a fair, and I'm still calling it coronavirus, at least publicly at this point. But so
it's
okay, there's a lot more coronavirus oriented episodes than I remember.
It's occurring to me that with my, like, guess what? You know what? I haven't had conversations with my mom, for example, or other friends like Ron and stuff. Like, how did you deal with that? What did you do?
We were so cut off.
Yeah.
And dealing with our own lives.
What was it like?
That, we just never really drilled down on this month, which was so weird this month.
Right. Yeah. I'm going to do that. I'm taking an action item to have chats with my close ones.
Yeah. All right. Well, tune in next time when we do chapter 4
of our 50-part series.
And everyone out there, please take care of yourself. Share your own stories below because
you deserve it.